how to understand it. And so what I'd like to do for a couple minutes, I'd like to show you how to read it. So if you're joining us today, say hello, please. I would love to say hello back to you. Let us know where you're from, and would love to answer any questions for you while you have me for the next couple minutes on this. So let's talk about what we do. So when you go get an MRI, for starters, you're obviously typically laying in a tube. And what happens when they do that is just like when you go to your grocery store and you go to get luncheon meat served and sliced. They ask you how thick you want it. They can set that machine thickness, and so they do slices. Sometimes you want a little thicker, sometimes you want a little thinner, right? Well, the same thing when you go to get an MRI. So when you're in the machine, the technician who is doing your MRI has the ability to determine how thick or how many slices and how close or far apart they are from each other. That's really important to know. So me personally, when I order MRIs, I love having 1 millimeter slices. Not all facilities will do it because it takes longer to do. Hi, Marisa. Great to have you here. Thanks for joining us today. And most of them are going to do usually a 3.5 or a 4 millimeter. The only problem with that, sometimes you can miss things, especially if they're smaller, so keep that in mind. That's something to ask your doctor if they can actually request you to have 1 millimeter slices, or at least 2 versus 4. You get to see twice as much, and sometimes that extra 2 millimeters can make a world of difference in seeing the quality and seeing inside your body. You're paying for it anyway, so make sure you ask for that, okay? And so that's the way it works. So what we're going to do is, I'm not going to show you, we're going to look at you from the side like this, and I'll show you a couple of things. So this will be the one bone, this will be the disc, this will be another bone underneath. You have your spinal cord right here that runs down through that tunnel, and then you have your nerve branches that come off, and then you have this thing called the spinous process. So we'll go take a look at that on a side view of your MRI here, so you know what you are looking at. All right, let's do this thing. So what we're looking at right here we'll start in the back, and so I'll help you get oriented. So this is the front of your body up here, so you know. So your belly button would be like up here, okay? And this is the skin on your back. So if you were to actually, touch your back, I know you can't really see it, sorry. If you touch your back, that's where your hand's at. Your hand's touching right here. Okay? And then we all have a little bit of fat underneath of our skin. So this white area that you see right here, that's fat. So when you look at an MRI, there's things that are going to be dark, there's going to be things like gray colors, there's going to be things that are white. So anything that is white has a high water content on what's called a T2 weighted image. And so there's T1 and T2 weighted images. T2, anything that has high water content, shows up white. So your cerebral spinal fluid is going to show up white. If your discs are really hydrated, they're going to show up white or really light gray color. Any sort of fat that you have is going to show up white as well. So I always think a T2 is like H2O. So the 2 in there helps you remind you that you're going to see water or anything that has high water content showing up bright white or light gray. Okay, so let's go and look at these. So what you're looking at right here are the bumps on your back called the spinous processes. So that's this part of your spine right there. So if like you were to bend over, you'd have a shirt on, you see those little bumps going down the middle of your back, that's what those are. Those are called the spinous processes. So they stick up. And these are your pedicles. You don't really need to know about that right now, but just so we're talking about it, that is this part right here. It's called the pedicle. So the pedicle attaches to the front of the bone to kind of the back of the bone without getting too technical about it. Okay. Let's go talk about the things that you are going to see quite easily. So we are in the middle, just so you know. The slice that we took right here is right in the middle of the spinal column. So you're going to be able to see the spinal canal really well. So this is going to be your spinal canal. And it's the back of it. And this is the front of it. And what's in that spinal canal? Well, your spinal cord is in there, and spinal cord comes down, it's about like this. So above this area, it's solid, comes down to this point called the conus medullaris, and off of that is what's called the cauda equina, and the cauda equina is all these little, so the cauda equina actually means the horse's tail, and so we have all these like little filaments that run down through here. And if you look really closely, you can see it right there where I'm drawing it. And on the next picture that I show you, I'll show you, you'll be able to see it clearer. And those are called the traversing nerve roots. And what they're telling us is they're showing us, remember, our nerve branches don't just come out from the side like this, okay? They come out and then they go down to the next disc level and come out the next disc level. And so you'll see them coming down and then branching out. You won't see it, and then you'll see it coming out and branching out. So those are your traversing nerve roots, and that's what these are. Those are your main nerve branches that are coming out off of the spinal cord. Let's go to the front more, and you're going to see this is the vertebral body, or the front of the bone. That's this piece right here. Okay, it's that. And then what you have is this area in between are your discs. So there's a disc, there's a disc, and you see the color, especially like right here. That's the color we want your disc to be like. So when they're really well hydrated, they're going to be like almost kind of a white color, very light gray. That's what we want. When the discs start to become dark gray or black, it's called desiccation. I'll show you on the next slide. You'll be able to see the difference. We don't want that. That means they're dehydrating on you. And so again, another disc, another disc, another disc, and another disc. And when we go down this line right here in the front of the spinal canal, we want this line right here. You can see a little bit of bulging out right there, but ideally we want this line to be really nice and straight. We don't want to see if there's any protruding out like that. So this gives you an idea of hopefully some normal MRI, or very close to being normal. So let's go look at the next slide here, and let's go back to normal. And so again, L5 disc right here, and then L4 disc right there. Here's our spinal canal. Okay, so that's where your cerebral spinal fluid flows through. That's where your spinal cord flows through as well. And what's really cool about this is, remember we were talking about the traversing nerve branches? See this gray thing right here? There's one of them. There's another. So now these are going into L5. This is probably S1. Okay, so we don't want to see where there's a disc pushing on those, because that can tell us a lot about if we're getting like sciatic pain going down to our leg or to our arms or our hands. These are all low back MRIs. Okay, so that's pretty good. Again, fat underneath the person's skin right there. And then these are the spinous processes that we talked about. Those are those bumps that go down the middle of your back. Okay, so let's go to this, where you start to see that now we start running into a little bit of an issue here. Here's the disc, and here's the back of the disc. So you see how that disc is starting to want to push out. Again, that disc is wanting to push out. So without seeing the view that looks like this, so I always ask my people, if you guys are on Facebook and you're in a group and you're showing your MRIs and you're asking for suggestions, recommendations, what is this? I ask that you do 2 pictures on it, please. You want this picture, but this picture really doesn't give you all the information you want. You have to get this image right here, because this is what's really going to show you what's happening on your disc. Is it bulging? Is it herniated? Is it extruded? Is it sequestered? It's pretty tough to tell that from just a side view. So if you have the capability of showing both of those views, I'm able to help you a lot more, just so you know. Okay, so we see that we got some protrusion there. We don't want that. Let's go to this area. So now we're going to go into more severe, all right? And so now you can see more of a black blob coming out of there. And whoever did this picture called it mild disc bulge. But one thing I want you to remember is that mild doesn't define it in a good term, because a bulge to a disc, that might sound minimal, but it's not minimal, because you have to understand what's happening inside your body. So if this is looking at your spine again, and obviously, this is This is the jelly on the inside, and then you have these outer rings. Okay, does everybody get that? And the jelly is supposed to sit in the middle. These outer rings are supposed to be very strong. If they start to tear, like you see in this model right here, you can see the difference. You see that red on the inside, that jelly, how it's squirting outward, and it's because these outer rings have torn, and that's a bulging disc. So if you have a bulging disc, you have to realize you have a tear, at least one tear to the inside of the disc, the annulus fibrosus, the tough bands that wrap around and keep that jelly on the inside. And now it's allowing that jelly to start to migrate. And so inside, if you're looking at this model right here, right, the disc should be the same shape as the bone. But when a disc starts to tear and bulge, and your body weight goes through it, it can't hold itself in its normal position, so it starts to push out like that. So that's a disc bulge. If you can see this red material, that's that jelly on the inside. So if we have a bulge and we do that, that will push out. If it tears all the way through, and then that jelly can then start to push out like that, that's a disc herniation. So bulge, once it comes out of the disc in any way, shape, or form, that's a disc herniation. And that sometimes can lead to a more severe issue. So let's go look at this slide right here. You're with me. And here is where this jelly has come out of the disc that you can see from the side. Ideally, what we'd want to see is we'd want to see it from this view, because then we can see, is it coming into this off to the center? Is it coming off to the side? Okay, so you can have a central herniation right here. You can have a paracentral herniation right here. And then you can have a foraminal herniation out here. Those are the tough ones. You don't see them a lot. Usually you're going to see them right here and right here, called paracentral herniations. And the reason is because there is a ligament that runs right here called the posterior longitudinal ligament from like about there to there. And it's weak right where it ends, and where it ends is here and here. I've showed you this on some of my other lives, and that's usually where that nuclear material, that jelly, wants to squirt out, is there and there. Sometimes you'll see it in the center, but usually one side or the other. So that's what you're seeing right here. It just doesn't show us which direction it is. So I hope this added some good information to your life. If you're suffering with back pain, I'm sorry that you are. I know that it can be really incredibly debilitating. I've had it a couple times. If you've been with me long enough, I've showed you some of the nasty pictures of my back when I was down for the count after I injured it. So I have a lot of empathy for you, but I want you to know that you can manage it without surgery and without drugs most of the time, with almost like an 88% success rate. When I was in my clinic, we had about 93% success rate with our patients using spinal decompression on their spine. So you definitely want to take a look at that. It is probably the best modality. So don't let a surgeon talk you into surgery when it comes to bulging and herniated disc. Most of them can be managed, and actually managed really well, so that not only short term but long term in your life, your discs get healthier for you, and you're not just cutting out a part that's pushing on a nerve and you still have a diseased disc inside that'll go from here probably, and as you go on 3 to 5, 10 years later, winds up like that. So we don't want that happening to you. We want you going the opposite way, okay? We want you going from here to here. And that's why spinal decompression is such a great modality for helping discs that are bulging and herniated. So if you want to learn more about that, you can go onto my website, drshawnmcwilliams.com, and you'll learn a little bit about the neck and low back. You can look at some amazing testimonials. There's some great stuff on there. You can learn a lot about us. If you have someone that's suffering, I hope you'll share this, especially if they have one of these discs and they can go take a look at it. You'll sometimes the discs themselves will have a reader on them. Sometimes you can download a DICOM reader, they're called. You can get some for free. Radiant was one of them that I used to use that was free for a little while. So you can go take a look at that, and you can put your disc in and it'll pull your images up. That's what you want to do. But if your family or loved one or a friend or a coworker needs help and they're suffering, I'd love to help them. So I hope you'll share this. I hope you'll like it, and leave me a comment as well if you have any ideas. If you have any questions for me, I would love to answer them for you. So I hope you guys have an amazing weekend. If you don't have any comments for me, I will see you next week. at the same time, 1 o'clock here, YouTube and Facebook at 1 o'clock. And if you want to catch me over on Instagram, we do that at 12:30 as well. So same show, always a little different though and fun. So I appreciate you guys so much. Thanks for being here. Marisa, great to see you as always. And see y'all next week.